Hello, everyone, and welcome to The Public Good. This is Deja James. I'm Director of Policy Advancement and Media here with Partnership for the Public Good, which is an organization that convenes 350 organizations to build a better Buffalo. We have a community agenda process. People are able to come, pitch ideas to make policy change in their own communities. So we're really excited, but also every week we bring you this lovely podcast from the Pod Hub agency. Shout out to Jamil Cruz. To talk about community-based issues that are happening that maybe don't have as much media coverage. And so we're really excited today to have my guests here who I'm going to let introduce themselves. But we're going to discuss today community responder models and alternatives to policing. And I think especially with the Black Lives Matter movement and different things like that, it's such a present time to be talking about what is the visioning for alternatives to policing? We know the police aren't good, but what else can we be doing? And this is an option. So I'm going to go to my guests, whoever wants to introduce themselves first.
Okay, I'll go first.
Okay.
My name is Charis Humphrey. I am a youth engagement coordinator at the Erie County Restorative Justice Coalition.
And I'm Colleen Kristich, and I'm a senior community researcher at PPG. And we're both members of the Erie County Community Responder Coalition, which is a base of about 6 organizations all working on bringing community responders to Erie County.
And you guys have been working on this for years now. So I guess I also want to kind of like zoom out and go to the back to where this came from, where was the inception of this idea. But can you just start out by saying, what is a community responder for those who may or may not know what that looks like?
Yeah, so community responders are becoming a fairly common approach to health and social needs in the community across the country. We don't have it yet here in Buffalo and Erie County, but over 100 cities now have community responder programs. And what it is it's a fourth type of first responder. So just like police, firefighters, EMS, there are health workers and peers who go to low-risk social and health-related calls in the community, like checking welfare, mental health and substance use issues, someone who's intoxicated, someone who's experiencing homelessness, where there's no violence happening, there's no crime happening, but the community responders show up, provide assistance to them, and help them, resolve whatever's going on.
Yeah, that's amazing, because I think, and I've obviously been a little fly on the wall to the work that you've been doing for a while. But I think the most present thing and statistic that you gave, and I don't know the exact statistics, but like a lot of the 911 calls aren't necessarily like really violent, need police intervention emergencies. And so who really is coming to those calls? It still is police, and often they're the ones escalating a situation beyond where it needs to go. And I don't know if you know that statistic off the top of your head for people, but.
Yeah, so we started a couple years ago kind of with that question of like, okay, we know that when police respond to everything under the sun, there's all these issues. Even in a best case scenario, if the officer is, trying their best, like they often just don't have this tools that situation needs or that person needs. And so we started with that question of like, okay, what else could be done? Who else could respond to these calls? So we foiled for police data on 911 calls, and we analyzed all the calls between 2020 and 2022. And it turns out that over 80% of calls to 911 that go to Buffalo Police are not about crime or violence. They're non-criminal things. A lot of them are traffic-related, alarms going off, and then a lot of these sort of general calls where there's some type of argument or dispute, or someone's worried about someone's health or welfare, or there's just something going on that doesn't seem right, that someone's concerned about, and they want some help with that situation. And yet 911 is really the only number most people know to call for help. And so when people call 911, when there's some of these issues going on, it's almost always police that are sent. So over 70% of the time when you call 911, police get sent. Yeah. And that's really because we've invested over time in policing as the solution, and that's who is available. That's the mechanism that we have for getting help, is sending police. And so community responders are rapidly becoming just this new approach that for those calls that don't rise to that level of violence is happening, a crime is in progress, they can go and really do some problem solving on the scene.
Absolutely. That's so powerful. And so for community then to buy into that, and I want to talk to you, Charis, and a couple, for who else is involved in from community level to want to get this work done and to see this change in policing and community, and like, what is the community saying about how they're being policed, and how do we take our agency back in saying, no, we don't want this type of response, we want this type of response?
I think so far the responses we've gotten from community are just some of the issues that they see on the day-to-day, whether it's with their kids and, the busy time of getting off the bus and things like that, or if it's, again, like maybe just neighborly disputes or issues, or we hear them talking about issues they've had with police in the past where they feel like an issue was not resolved either responsibly or, also that they sometimes, like you said, feel like their agency is taken away in many situations. And so that's been the call of support that we've seen so far. And we're continuing to talk with folks in our pilot area, or our projected pilot area at this time, to just make sure that we're really wanting to meet their needs and, go about it in a way that they agree with and support.
And I love that you brought up that one, community already had buy-in for this and know how they want to be responded to. But two, you do have a pilot coming up, that this is something you're tangibly doing. It's not just something that it's an idea and we're just discussing. And it has been years that it has been an idea and you guys have worked on the advocacy, but we're actually at a place where you have investment from the state to do something like this in Erie County. So I don't know if either one of you want to talk about what that opportunity is that we're seeing now and how you're kind of going to see that through.
Sure, I'll start, but Charis also add in, please.
Okay.
So we are happy because we are announcing $100,000 from the state tomorrow. Actually, we're releasing a report and announcing this funding that we're getting for continued community engagement and training and data collection and outreach to begin a pilot. So it's an initial sort of down payment on doing a pilot in Buffalo. And from the work the coalition has done, community conversations that we've had, what we would really like to see is really something that's very community-based and community-driven and community-led. And so we're talking about a pilot that would be around like 20 blocks, like maybe 5,000 people living in this small area, who the community responders would be hired from the community, would be trained and, have the skills that they need, and be so familiar to everyone in that neighborhood, all the business owners, all, the residents, the principals at the schools, the teachers, the police officers that work in the area. Everyone would know who they are, know their name, know what they do, and really that it would be built on trust and built on that relationship and grow at the speed of trust, and that the pilot would, start out in that area and effectively meet people's needs and then grow from there and learn from whatever lessons come up within like the first year.
So what type of background when you hire a community responder, like who do they have to be to qualify to be, or is it you're using a mixture of mental health professionals, of community leaders, of things like that? Like what does the makeup of a community responder look like?
Around the country, it looks different. So in San Francisco, for example, they have a group called the Street Crisis Response Team, and it's an EMT, a clinician, and a peer. So it's a team of 3. In other places, in St. Petersburg, Florida, there's something called the CALL program, and they just hire people from the community who maybe have some type of background in human services or just life experiences that make them good at it. And they go through classroom training and in-field training to get skills in de-escalation, crisis intervention, understanding mental health and substance use, harm reduction, an understanding of the local resources and how to connect people with them. Really, like a lot of those things can be taught. You don't have to have a degree in order to be able to stay calm in a certain, like a degree doesn't teach you how to stay calm in a certain situation, how to build trust with someone, how to relate to them. Like those things, I think that if the person brings those to the job, a lot of the other stuff you can teach.
Absolutely. And you mentioned other cities that have this model already. So it's something that has been implemented, at least on small scale, other places. And I guess this is an initial investment, but you are seeking for it to expand further in City of Buffalo, Erie County, Western New York wide, right?
Absolutely. Yeah. Mm-hmm.
Absolutely. No, that's great. And so, Charis, I guess my other question from your perspective, are you from Buffalo? I just wanted to ask.
Yes.
Yeah. Mm-hmm. So what type of change would you want to see once community responders is implemented? What are you hoping to see, you know, in terms of like success? And what difference do you think that would make in the community once police aren't necessarily responding to these calls that they don't have to be involved in?
Well, I think the first marker for me would just be, like me and Colleen have talked about this a lot, like everyone in the pilot area having like a magnet on their fridge, knowing the number right away. Like Colleen mentioned, recognizing the folks that are their first responders, and not necessarily just because there's a crisis, but because they're in the neighborhood so much. They're like, you know, neighborhood intel, if you will, like they just know what's going on. That would be a first marker for me. And then I think, excuse me, just like a downsizing of like, again, just harsher issues. Like again, my background is, you know, restorative justice. So I feel like the more relationships that are being built in the community amongst people who probably otherwise wouldn't know each other is a marker that it's successful. I think people having a shift around the mindset of mental illness and you know, even homelessness, like when we start to see people shifting the way that they talk about it with each other, I think that would be a marker that, you know, all this is successful. And yeah, just think less sort of like futile responses to issues in general.
Like a response that actually brings a real solution.
Yes.
To, like, because I think right now, if somebody's having like a mental health episode or overdosing, it's like, it's not useful to just put them in cuffs and like take them to county. Like that's not actually a useful solution. And especially in terms of like drug rehabilitation, I think some people think like, oh, well, if they go to jail, like they'll detox and that's somehow restorative or rehabilitative, and that's like completely the opposite actually case scenario. So when community responders are then responding in alternative, what are some of the other solutions? As you said, like mental health professionals can be coming along, but if there is a case scenario with somebody with a mental health issue is, or, you know, there needs to be Narcan or different things like that. What are some of the alternatives of we're taking people to rehab, or we're taking people, what are some of those alternatives rather than just taking them to jail like we usually do?
Yeah, I think a lot of the time we are accustomed to the idea that like when you call 911, someone should come and like remove that person from the community, and to like, maybe not that they should, but that's just what we're accustomed to seeing is like that person being removed. And it is, you know, to jail or often to the hospital where the same thing happens. Like either they're there a couple hours and then they come back out and nothing's changed, or, you know, sometimes they get some type of coercive treatment that can be pretty traumatic. And what we really want to see is, again, this relationship built on trust, where it might not be that person's underlying issues are going to be solved that day, right? But like they can get a conversation, they can start to build that relationship. In some circumstances, they just need someone to talk to. Community responders usually travel in vans that have like food, water, personal care items, socks, like comfort things there, some basic medical care, so that if it really is just like someone's hungry and they had an outburst, or like sometimes it's something very simple that can be solved like there with a conversation and some basic items. Most teams are also able to transport people. So if they do need to or want to go to a stabilization center or a respite house or something like that, they can then take them right there to that place without having to call an ambulance or a police car or something like that. Currently, we don't have that. Like if you call 911, and even honestly, if you call like crisis services or something, they don't have the ability to transport people themselves. So you have to rely on an ambulance. So it's a lot of just like problem solving in the moment, and community responders the model is meant to be flexible. So if it's like, hey, you need me to call your grandma, like, what's her phone number? I'll call her. I'll talk to her. Maybe she can come pick you up, or maybe that's the person you really want to talk to. Maybe you don't want to talk to me right now. Maybe you need to talk to this person that you trust more. In other cities, it's been like, this person needs somewhere to stay tonight. We're going to call around to motels that will accept, the small amount of money that they have. Like, it's really about just being there for that person and helping them get what they need, and much less about, coercion or removing them from the community, but really seeking out what it is that they most need in that moment.
Absolutely. And so when you talk about all these alternatives, I think that they're so ideal. And I think that sometimes there's a huge gap between what we want to see and what we envision, and like what our current government or structures actually are willing to implement or envision. And so I guess I want to ask the controversial question of, what has the reception been from local police or local elected officials around you all pushing this initiative? How have you felt supported or not? I mean, I guess I just am curious about what that's been like for you all in the advocacy side of it.
I think, of course, there's always going to be, a little bit of pushback or people who are not like completely on your side. But our response from the police has pretty fully so far been that they recognize that there's a limit to the training that they receive, and they recognize that, they go in for a particular kind of training, and so that's the kind of issues they want to respond to as well. At least, that's pretty much been the response that we've gotten so far is, they recognize that this is just, it's not really in their playing field, and they do feel, from what I understand, overwhelmed at the amount of issues that they are expected to respond to.
Yeah.
And so, everyone has to recognize their lane, right? And so, it's been a pretty generative response, in my opinion.
Because arguably it does help with their job. I mean, it takes calls away, less responses. They're able to focus more on other things, detective work. I don't know what else they're doing, but other things that take more capacity, right?
Yeah, and there's like a lot of repeat calls about the same thing happening over and over again that police are tired of responding to over and over. That's one thing that we've heard, is like getting to that root cause of the issue is definitely mutually beneficial for everyone. And really everyone we've talked to has said, like, this is a good idea. Like, we like this idea. Mm-hmm. It's just a matter of like, who's going to run it? How much is it going to cost? Like a lot of, the practical implications. And what's really helped, I think, even our coalition is looking at these other cities that have already done it and that have already, got a lot of takeaways of how it can be done here, and really around those logistics. So we're getting to that point where we have a lot of those questions answered, I think. Yeah.
So speaking of like who's going to run it, like what level is this going to be on? Is it county? Is it city? You got state investment for it. So where does this even just pilot live? And then where do you envision it living in the future? Is it a city-based thing to help with Buffalo PD? Or as we know, Western New York is an area of first string suburbs also. So it's not just like the immediate metropolitan area. So where does this live so that it has like kind of the best effect for Western New Yorkers in general?
Yeah. I mean, that's the big question, honestly, which we don't have 100% of an answer to. We want everyone in Erie County, eventually someday, everyone in Erie County to be able to call a community responder 24 hours a day and have someone show up within half an hour. We're not there yet, but we do want to see a pilot that starts out as a community initiative, not a city-run or county-run initiative, because
that's so interesting.
It's a new thing, and honestly, and it's hard to do new things in old structures, and which is really why, like, when we've, really envisioned, hiring people from the community, having really this huge level of buy-in from people that live in the neighborhood, we wanted to have that much sort of control over it, honestly, of like exactly what the responders would do, how they would give feedback on if something was not up to the standard. We want there to be a lot of transparency, accountability, feedback, all of that. And then where we go from, a small pilot up to everyone in Erie County having access, that's an unanswered question. But we're trying to get started with that kind of small pilot within the next year or so.
And then when you implement that pilot, how long do you anticipate that pilot running for before you're kind of advocating to expand or different things like that? Or is it kind of like we have to try it out and see first? Yeah.
I think try it out and see. What do you think, Charis?
Yeah, I think we're taking the steps to get it started, and I think we're looking at least 1 year from when it starts to really like regroup, decide how, successful is this? Do we have really the capacity to start to expand, and then where, right? Because it took a lot for us to even decide what would be our current pilot area. Where do we want to start it, so it would be.
Have you selected that already? Like what area? Are you ready to announce it? It's okay if not, but
we should tomorrow.
Okay.
Right?
Yeah. We have ideas about like where we want it to be, but really honestly our next step is going door to door with like pamphlets about this is a community responder model. Like, what do you think about this? What kind of needs do you see in your neighborhood? And really using that feedback to, we have one design of a pilot that we would think would work, but we're going to change that depending on what we hear people say. So
right.
if people are like, you know what, we don't want this, then we're not going to pilot it there.
Right. Absolutely.
Yeah.
No, I love that you have that kind of a community feedback mechanism already built in, because at the end of the day, that's what this is supposed to be. It is community responders. So I guess the other question I have is, in trying to like implement it, you said you have like a coalition of about 6 organizations and things like that. Are those organizations kind of going to be the catalyst community groups that are housing the pilot? Or are you looking to kind of house it within a larger service provider? Or what does community-based mean to you versus it being city-based or something like that in the initial phases? How would you envision that ownership, temporarily for now?
I think we still do want to take big feedback from the community members. Maybe ideally it could be encompassed in one of the 6 organizations that has been working on this, but also, if the community says, oh, we definitely want this organization, or have you ever thought about these people over here, we would we want to take that into account.
You know what? I love that, because often, especially like in our area, there are like big organizations that already have certain connections or different things like that. And it's like, it's a given, such and such is going to have this thing, right? And there is no community input on that, even like cross-organizational input on that at times. And so I think I love the fact that for it to truly be successful in a community, they have to feel whoever's housing it is credible to them. And that could be different than who you, Charis, personally feel, or you, Colleen, personally feel, or who I personally feel. And so I love that idea. Like, I feel like I'm even right now, I'm asking questions from a mindset of like assumption, and you guys are like, no, the community has to tell us. And I'm like, you're right. So I love that. Like, you're even checking me on like, someone who feels like they do community-based work every day. Like, even you can kind of get in your own way of like, I'm doing this for a community, but like it has to come from community. So anyway, I just had that epiphany while we were talking.
Shout out to our coalition members, really, because that's like when all of us started doing this a couple years ago, we also were like, we just got to tell Erie County, like, you got to do this. Like, Erie County or City of Buffalo, look at this great idea. And kind of fortunately, they were like, okay, that's a good idea, but like, you figure it out. And on one hand, that was disappointing because we wanted to have this transformative, like, remake the first response system right at the beginning. But this has, over the years, like, kind of forced us to go smaller and smaller. But people in the coalition have been like, no, we really need to talk to the community. And I'm glad, because, like you just said, I started with kind of the same idea that this would be a policy change, that it would come from the government level. Yeah. And really what we're talking about is paradigm shifting, response to like how these needs are met in the community. And it shouldn't just be some sort of cookie cutter approach, like they're doing it this way in Cleveland, so we're just gonna copy paste. Like, we really want a Buffalo specific, like neighborhood specific approach. So fortunately we've kind of arrived there, and thanks to,
and I would hope that would aid to its success, even because it's so specifically tailored for a certain community. I would assume it's more embraced. It's more, it gels better. So I love that approach. I think that that's amazing. So I'm really excited for you all to be announcing this, and congratulations as well on accomplishing something that took so many years and years of advocacy and research, Colleen, and different things like that. I just commend you all for this effort, and I'm so happy the state decided to invest in, because sometimes they don't always take that risk on like something so grassroots community level. So I'm just really excited for you all. So yeah.
Thank you. Yeah, we thank you. We have a ways to go. I mean, this is great, like down payment, sort of like keeping us along the road, and we're gonna be asking for more funding from, honestly, like city, county, and state could fund this type of thing. And
they could fund all at the same time all together. Yes, also, by the way, like not one or the other, or the all together. Okay.
Foundations, anybody that wants to fund this pilot, we're gonna need more than $100,000 to get a team up and running that's like well paid. And because this is an important part of the vision, honestly, is we're not wanting like volunteers to just like work for nothing with these really sometimes heavy issues and get burning out. Like, we really envision a fully funded, well paid team doing this work. So advocating for more funding is going to be in our future for the next year, but we're super excited to have something towards it and really hopefully see it come to life within the next year or so.
And I think it's so timely, especially like in our current political climate where people are like, we're losing control of our cities. And they feel like the answer to that is we need to go back to policing. We need to go back to being more heavy handed because we're unsafe. There's like that narrative out there, right? And there's still no like looking at root causes. There's still no looking at community need or immediate need, because maybe somebody is just houseless and hungry and needs some water and some shoes right now. Right. And so what are we doing about that? Because police aren't going to be able to solve that. That's not a mechanism or even a function that they should be doing. And so I think bringing this alternative in at this time can kind of be proof of concept of how we can, like you said, have a paradigm shift in how we're responding to societal issues. And hopefully, as we're in this like changing time, we can have some good things popping up at the same time, some of the bad, so that we can maybe neutralize it. I don't know if that's too hopeful. But thank you so much, both of you, for being on the show today and talking about this. I know our listeners are going to be really interested in seeing where the pilot goes and wishing it successes and all of that. And hopefully we can have you on in a year and talk about how it went.
Oh, yeah.
That's
yeah.
Right.
Awesome.
Responders on here. Hopefully that'll be in the community by that point.
Cool. So we are going to be releasing a report, PPG. Colleen has worked for many years now researching this initiative. And so we're going to be releasing that. We're taping it this episode the week before. We're actually going to be doing some of the things. So by the time you see this episode, it will be live and up on ppgbuffalo.org. So please be sure to go check out our website to learn all about community responders in Erie County. And possibly if you want to reach out and be a part of helping this come to fruition, please reach out to Colleen, PPG, or any of the other groups that have been organizing around the community responder model. There's going to also be a press conference up on our social media pages, PPG Buffalo. Check it out, Facebook, Instagram, all of those places. So please stay tuned for how this pilot goes and the investment. Thank you, ladies, both so much for being on the show today.
Thank you.
Our pleasure. Yeah. Thanks, Deja.
Totally.
Awesome. This was The Public Good. I am Deja James with PPG, and we hope to see you next week. Bye.